Welcome, everyone, to Ask the Experts podcast. We truly appreciate each and every one of you who tunes in week in and week out to listen, learn, and grow. And for entrepreneurs who want to scale their life and business, it's really important as to what you do every day so that you are sharpening your skills, you're sharpening your knowledge. And I am so excited for my guest today, Dr. Heather Skeens. Dr. Skeens is a renowned ophthalmologist and an entrepreneur. She has over 22 years of experience specializing in corneal transplantation and cataract surgery and refractive procedures. Dr. Skeens has advanced surgical techniques, including partial and full thickness corneal transplants. Dr. Skeens is also the visionary behind Bellacy Education and Bellacy Beauty, whereby she merges luxury with medical precision to create transformative eye care experiences. Dr. Skeens, welcome to the show.
Thank you. Thank you for having me.
Well, let's start by what made you fall in love with ophthalmology?
So actually, the summer before I started medical school, I worked in an ophthalmologist's office just for a summer job. And he kind of, took a special interest in teaching me. I went room to room with him. I was his scribe, but he knew I was going to medical school, so he took the time to teach me about the eye. He actually bought me my first ophthalmoscope, which is an instrument that we use to look inside the eye. And he took me to surgery with him, and I just loved the field. I didn't remember at the time. My mom told me that when I was growing up, she showed me this old eye model that I played with like in the 70s that I had no recollection of at all, but she gave it to me. She kept it. I still have it. So evidently, I was drawn to the eye and didn't recall that, but it was my experience with him. When I went to medical school, I knew that that's what I wanted to do.
I think that's so interesting because having a mentor, it's just one of the greatest experiences that we can have. And I mean, especially, you're a junior doctor, you're starting out,
Mhm.
and working in a hospital environment. I mean, I can just imagine it's very fast paced, and there's just so much depth to learn.
Mhm.
Did you enjoy the hospital, or did you enjoy more the outpatient when you were in med school?
So Yeah, so I enjoyed more the outpatient. And that sort of goes along with my field, right? So the surgeries that we perform are outpatient surgeries. So to get into ophthalmology, you have to be at the top of your class. And you also have to do your first year out of medical school. You have to do either in internal medicine or you have to do a surgical year in general surgery. And so I chose to do internal medicine. And the reason for that, and that's the year prior to starting an ophthalmology residency program. The reason for that is because people forget that the eyes are connected to the rest of the body, right? So every disease that affects the body also affects the eye. And when that's one of the things that I love about the eye is that I can look at a person's eyes and often diagnose what's going on in the rest of their body by the presentation of the eye or the symptoms that they're having. So, but I did enjoy the outpatient side of things more than the hospital environment. Enjoyed the outpatient surgery setting as opposed to a hospital surgical setting. So yeah.
Right. No, that's amazing. It's so good to have that depth of experience anytime. So, how long does the training take after med school? Is there a in-depth training after you graduate?
Yeah, so after medical school, again, you do that first year in internal medicine or general surgery, and then there's 3 years of ophthalmology residency training. And then when you complete residency training, you can either enter practice as a general ophthalmologist, or if you want to subspecialize in a part of the eye, you can do a fellowship, which is what I did. So I did one additional year of fellowship training specifically for cornea transplantation and advanced complex cataract surgery and refractive surgery. So that is an extra year. So now we're 5 years out of a medical school education. So 4 years of medical school, 5 years of training after to be able to do the things that I do today.
That is wonderful. That is so good. What would you say are the unique specialty that really explain, if you can explain to the viewers, what's the unique part of your specialty
Mhm.
that, you have the passion for, and every single day this is what you are doing. So can you explain to
Sure.
us?
Yeah, so I have a couple of passions. With respect to surgery and eye disease, one of my passions is in an advanced form of cornea transplantation. So the cornea is the front window of the eye. I explain it to my patients like the windshield on their car. And it's the part of the eye that covers the colored part of your eye, the iris. And it's the first thing light enters when it enters the eye. It's what people put their contacts on, their cornea.
Right.
And the cornea has several layers to it. The inside layer is nothing but a layer of cells, and their job is to pump water out of the cornea, much like the windshield wipers do on the car. So that's how I
Mhm.
explain it to my patients. The cornea is made of collagen, so it's like a sponge, and whenever it gets wet, it swells. So, patients have either an inherited genetic condition that affects these pumping cells on the inside layer of the cornea, or they have damage to these pumping cells from a virus or from another eye surgery, for example. But if these pumping cells don't work properly, then fluid cannot get pumped out of the cornea. So it's much like your windshield wipers don't work on your car. And that fluid builds up and that cornea swells like a sponge. And then things look very cloudy to the patient, like you're looking through water. And so, one of my favorite techniques is to replace these pumping cells. And it's really fascinating the way technology has advanced.
Mhm.
It used to be so the whole cornea, when it's a normal thickness, is 540 micrometers in thickness on average. This layer of pumping cells is only 10 micrometers thick. So that's micrometers, that's thinner than a human hair. Okay. So this layer, though, is the most responsible for keeping the cornea clear. And when it's been damaged or an inherited dystrophy has occurred and those cells don't work right, and that fluid builds up and the patient can't see, we can go to surgery and replace just that 10 micrometer layer. So there's a form of corneal transplantation called a DMEC, and that's where we remove the abnormal cell layer, again, thinner than a human hair, that's not working properly, and replace it with just those cells from another human cornea, and we put those cells in the eye and we fill the eye with an air bubble because they're so thin you can't suture them in. That would damage them. So you fill the eye with an air bubble and the pressure from the air will press them on to the back of the cornea and they will adhere like a suction cup and they will start to work just like you got new windshield wipers on your car and they'll pump all that fluid out. And typically within a week, the patient is already noticing improved vision. And then it just continues. And patients with an otherwise healthy eye can get back to a 2015 or 2020 vision. And the reason I love this technique is that even in my time, I've been practicing for 22 years. When I very first started my training for cornea transplant in 2006, at that time, surgeons were just stopping the process of replacing the entire cornea for only this 10 micrometer layer being abnormal. With this problem, we used to have to remove an entire cornea, sew a new one in with stitches, which is still a surgery that we do for different reasons today for scarring and things. But at the time I started school, we were just learning how to transplant a 100 micrometer disc onto the back of the cornea instead of removing the whole thing. And now in the time that I've been in practice, now we're down to 10 micrometers. And the next step is going to be actually that, and it's in works today, where we actually can culture and grow these cells, these endothelial cells on a culture plate and then put them into a patient's eye. So that's the next step for cornea transplantation. But that's my absolute favorite procedure to perform. It's so satisfying for the patient.
Oh, that's beautiful. That's so amazing. And what I love about, medicine, the technology is just changing at such a fast pace,
Right.
right? It's such a fast pace. And I recall like in the 80s, they used to have like the conveyor belt system. Correct me if I'm wrong, but that's what I heard that, if you want to go to have your, was some procedure that they were doing, it was like a conveyor belt. And I would think, oh my gosh, isn't that risky? That,
Yeah.
one patient after another.
Mm-hmm.
And how
So
much is advanced?
So how much is advanced? So cataract surgery, in the 80s, we didn't have lens implants. So cataract surgery, you may be thinking of, a cataract forms in the eye when the natural lens in the eye, we have natural lenses in our eye. You can think of them like camera lenses that we're born with, that when we're babies, they're clear. And as we age, those lenses age with us, and oxidation turns those lenses brown. And so then our clear lenses are brown, and then we call them cataracts. Now, babies can be born with cataracts. Children and adults of all ages can have cataracts, but the most common thing is that a cataract forms based on the aging process. And so now, when we do cataract surgery, what we're doing is removing this aged lens from the eye in a simple outpatient surgery that, in my hands, for example, is about a 6-minute procedure. We're removing this lens and we're replacing this lens with an artificial lens implant. And that implant can be thought of like a mini contact lens because it's got a glasses prescription in it. And as the doctor, we can tailor that prescription to what you would like your vision outcome to be after surgery without glasses. But back in the 80s, they were just figuring out how to do these implants. And so people would have cataract surgery, like you're talking about, and the
Right,
cataract would be removed, but a lens implant would not be put back because we didn't have them. And
right.
so then you saw people walking around with those really thick Coke bottle glasses, just really thick glasses, if you recall, because they had to be so thick because they didn't have lenses in their eye to help with any of that. I
Oh,
think
wow.
that's what you're thinking about.
That is what I'm thinking about. Yeah, it was like a conveyor belt, that one patient after another. And I would think, well, that is really risky, that procedure. But it just amazes me how technology advanced, medicine has really advanced so much, and doctors nowadays can perform surgery just like that, and the patients are able to, see much better. I was just talking to a woman in the grocery store. She recently had her cataracts done as well,
Mhm.
so far she feels good. She looks really good. So yeah.
Yeah, usually within about 24 hours, depending on the severity of the cataract. If the cataract is very, very mature and it requires more energy from the ultrasound handpiece to remove it from the eye, then the patient may have some swelling for a little longer in the eye after surgery, and that can delay their vision recovery. But even at that, it's usually not more than a week. But most people within 24 to 48 hours can already tell a large improvement in their vision, and they're happy.
Oh, that's beautiful. So let's talk about the eye care itself. Now, when you have a sty in the eye, what causes a sty?
So styes in the eye are very common. So at the base of the eyelashes are oil glands. Every one of our eyelashes has an oil gland at the base of it. And that oil gland should secrete oil onto the eye to lubricate it as part of your tear film. So your tear film has 3 components to it. So your eye makes mucus as one of the components. You also have a water component, which is made from the lacrimal gland. But then you also have an oil component, and that oil component is made from these oil glands at the base of the eyelash. So when the oil does not come out properly and it gets clogged in the gland, think of it like a pimple. That's what a sty is. And so the causes for that are many. Hormonal changes in men and women as we get older, as hormones decrease in the body. The oil glands don't have a stimulus to secrete. That's one of their stimuli, or hormones, to secrete oil onto the surface of the eye. And the composition of the oil changes. It gets very thick. So hormone changes in the body are a big contributor to blocked oil glands. Vitamin deficiencies are another contributor. But most commonly, we don't know this, but our eyes and teeth, there's something that goes together. So the inside of the eyelid is a mucous membrane, just like your mouth. And bacteria that live all over our body, they live in our mouth, they live on our eyelids too. And these bacteria form what is called a biofilm. And a biofilm is what plaque is on your teeth. So
Wow.
yes, so they form this biofilm on the edge of the mucous membrane of the eyelid, and that film, just like the plaque on your teeth, it blocks the openings to the pores where the oil should be coming out. And so not only is the oil thicker as we get older, it's not coming out well already, but now we have this plaque on our eyelid and it's blocking the pore and the oil can't come out. And all of this adds up together and people get styes. And really, over 80% of the population suffers from a problem with dry eye from blocked oil glands.
Right. Wow. So is there something that you can apply for a sty, like a
Yes.
ointment or cream, something that you can apply, or there isn't
Yes.
anything for that?
No, there are lots of things, and the most important thing you can do to help prevent a sty and to treat one when you get that
Mhm.
are warm compresses and massage. So we don't think of it um, as women, that wear eye makeup are cleaning their eyes a lot because we're taking off makeup, right? Men, not so much. So we do see it a little more commonly in men because they're not paying such attention to clean their eyelids and lashes.
Right.
But a number one thing you can do in the shower is simple. You should do every day is clean your eyelids and lashes very good to help minimize that biofilm. I tell my patients to think of it like you're brushing your teeth. Think of it like your toothpaste. You need to use a cleanser on your eyelids and lashes. And there are specific cleansers designed for that you can pick up at the drugstore over the counter. I also have some personal recommendations if anyone wants to reach out. But cleaning every day is a prime thing to prevent that. But if you're getting one, doing a warm compress with like a washcloth with the water as hot as you can stand it, that you can just hold, and it feels very good to just hold the hot cloth on the eye. Think of that sort of like the heat melting a stick of butter. So those oil glands, you're going to heat up that oil, and then you take your finger and you just kind of massage and you just press in on the eyelid against the area where the sty is. You'll feel that there's a cartilage plate below your eyelashes, right above the bone. And if you just kind of press in on that cartilage plate, you won't see anything, but you'll be milking that oil out of those glands. Your vision may get a little fuzzy or milky after you do that because you've just squeezed a lot of oil out onto your eye. And so that is a good thing to do. And that is something when you have a sty that you can do to help express that gland. But if it's a very large sty and you're doing these warm compresses and massage and it's just not getting any better, then you need to call your eye doctor, and there's an antibiotic eye ointment that can be prescribed. And you shouldn't use antibiotic ointments that are for other parts of your body on your eye because they're not sterile. You need a specific ointment for the eye that is sterile that you can put to help that sty go away. If a sty hangs around too long and it doesn't go away, and the problem is that the oil that's in the sty can harden into a knot of inflammatory tissue, and that has another word called a chalazion. And those knots are things that your eye doctor may actually have to perform a small, minor surgical procedure in the office to help release the inflammation. Then, so to summarize, warm compress massage, and if it's not getting better, you need to call your eye doctor for an antibiotic ointment.
Right. And can a sty sort of you know, uh, be anywhere part on your eye, like on your upper
Yes.
lid, lower
Yes.
lid?
Yes, it can be anywhere you have an eyelash because at the base of that eyelash is one of those oil glands. So you can have a sty anywhere. And, we do see these more commonly in people with dermatologic conditions like facial rosacea, especially even in children. I've treated plenty children, 5, 6, 7 years old, that have a problem with oil glands, okay, or they have an allergy to something and they're getting these frequent styes. And the reason it is important as a cornea specialist, your eyelid touches your cornea. Okay, your eyelid touches your cornea, it touches the front of your eye. And so the longer that process sits there, that incites inflammation, and that inflammation attacks your cornea. And your cornea is supposed to remain clear and transparent in order for you to see well. But if the eyelid is touching the cornea, the eyelid is staying inflamed, these overgrowth of bacteria are sitting on your cornea. This will eat away at your cornea. You actually can get an ulcer. I've actually seen patients get a hole in their cornea from
Uh,
this process. Yes, and when it heals, either can lead to the emergent need for a corneal surgery or can lead to a permanent scar, which permanently affects the vision. So this is not something to take lightly. The average sty is just going to be quickly gone. You're going to treat it and fine. But if you're somebody who gets recurrence of these all the time, you have chronically red eyes and irritated, you should be seeing a cornea specialist to help make sure your cornea is staying healthy and that there's not any damage that's being done there.
Absolutely. Eye care is very important. Just like,
Yeah.
your body, your eyes are very, very important to have those regular checkups.
Yes.
What is the difference, Dr. Skeens, between an optometrist and an ophthalmologist?
Sure, and I get this all the time. An optometrist does not go to medical school. Okay, an optometrist goes to college and then they go to optometry school where they learn to specialize in the prescription of contact lenses and glasses. They also can handle some medical eye issues, for example, a red eye, some mild eye trauma, a scratch, etc. But an ophthalmologist actually goes to medical school, and that is outside of college. And, people, a lot of times people don't know the difference. And there's a big difference. An ophthalmologist is going to be a surgeon, right? Is going to be able to cut on the eye, cut into the eye, remove a cataract, cornea surgery, retina surgery. An ophthalmologist typically is not going to do so much with the prescription of glasses or contact lenses. You do have some ophthalmologists that will do that just because they like it, maybe. But typically, we rely on our optometry colleagues to handle those things for us, and we're more doing the surgical side of things.
Right, absolutely. And so, what are the common causes of blindness? Um,
Yeah.
when it comes to the age of our vision, what can we do to prevent blindness? Retinitis
Mm-hmm.
pigmentosa.
Mm-hmm.
I believe that's the terminology.
Well, you're thinking retinitis pigmentosa is you're thinking of a specific dystrophy problem with the retina, which is something that can is not is more
Oh,
rare,
right.
although people do have that. You're thinking of macular degeneration, which is something that's more common. And one of the most common causes of treatable blindness are cataracts, right? Especially in countries that don't have a lot of access to eye care and an eye surgeon. Cataracts are one of the most common causes of treatable blindness because we remove the cataract and then that restores the vision. Glaucoma and macular degeneration are two diseases that affect the eye that can cause permanent, irreversible blindness. And what glaucoma is a condition where the optic nerve in the back of the eye that sends the vision messages to your brain has had damage to it. And traditionally, we are trained in our residency programs, we are trained that eye pressure, the pressure in your eye is what damages an optic nerve and leads to glaucoma if your eye pressure stays consistently higher than what the average is considered to be in the population, which is 10 to 21. So pressure in the eye causes damage to that optic nerve, and that's what we think of as glaucoma. But what we know today and what makes very intuitive sense, if you think about it, again, the eyes are connected to the rest of the body, and inflammation is the root cause of every disease in the body. And so inflammation in the body for any reason can damage our nerves, right? We think of diabetics who have nerve pain in their feet, who have neuropathy. So this nerve in the back of the eye is the same as that nerve. And so just like our nerves in our body can be affected by inflammation and other diseases, the nerve in the eye can as well. And when we see nerve damage in the eye, we say a patient has glaucoma, but their eye pressure may be normal and they still may be diagnosed with what we traditionally have called glaucoma. So keeping the body healthy overall and decreasing inflammation in the body, maintaining a healthy body weight, maintaining a good diet, getting all of your nutrition, exercising, everything that you do to take care of your heart and your brain and the rest of your body should be done as a part of taking care of your eyes and helping to prevent diseases like glaucoma and macular degeneration. The macula is the center part of the vision in the retina. That's where our finest straight ahead visual acuity is. So when you look straight ahead and you see, that is your macula. So people who have macular degeneration, they have a breakdown in the photoreceptors in this part of the retina called the macula. And when they look straight ahead, they see black. They see a black circle. They will usually have their side vision intact so they can see around, which is the opposite of glaucoma. Glaucoma usually takes your side vision before it takes your center vision. Macular degeneration takes your center vision first, so people will tell you that they see a black dot or that they're looking at an image and it's got a black hole in the middle of it. That's macular degeneration.
Right. And it's like, yes, go
No, you
ahead.
go ahead. Yeah.
No, please go ahead.
Well, I was going to say that for prevention of that, I mean, you can have a tendency to have more inheritance with glaucoma and macular degeneration. We always want to ask the family history, because if a mom, dad, sister, brother has that, you could have inherited that tendency. But I always tell people something has to turn the gene on, right? Just because you get a gene for a specific disease doesn't mean you're going to get that disease. Something has to turn the gene on. Something triggers it. And so with macular degeneration, and with cataract, for example, we know that wearing glasses, sunglasses that protect your eyes with 100% UVA and UVB protection, help to protect the back of the eye from damage from the sun. So that helps to protect your macula. We also know that there are certain vitamins and nutrients that the retina uptakes that help to maintain the health of the cells. And then there you want to think about, for example, vitamin D, the most important hormone in the body that regulates everything, having that level adequate. Vitamin A, we've all been told to eat our carrots, right? Carrots have a certain amount of vitamin A. So thinking, our zinc, our selenium, all of our nutrients, our bodies are like cars and we want to put premium fuel in them. And so we have to be eating well if we want to help prevent these eye diseases.
Absolutely. It's very important to take care of your eyes because, when it comes to eye health and, what we don't know, but we can always like prevent as to
Yes.
what's about to happen. So let's talk about diabetes and, worldwide, this is such a common cause when it comes to diabetes. Now, if diabetes is not controlled, what can happen and what can lead to a person's health, and how can people help so that that doesn't happen?
Sure. So, diabetes affects every aspect of our body, and the eyes are no different. So, with the eye, with diabetes, what we can see is called diabetic eye disease. And what happens there is that the retina Again, I tell my patients that the retina, which is the wallpaper that lines the inside of the eye, you can think of that like your car engine. And the retina has all these blood vessels and nerves in it, and it's processing information and sending that to your brain in order for you to be able to see. And in diabetes, the retina grows abnormal blood vessels. So in the eye, we see an overgrowth of blood vessels, but these blood vessels are not healthy blood vessels. They're fragile blood vessels and they bleed. And so diabetics can have blood vessels growing throughout the back of the eye that are bleeding a lot. They're very leaky. And so this process called angiogenesis damages the retina and leads to loss of vision, permanent loss of vision from diabetes. Diabetes is also associated with early cataract formation. So the increased blood sugar levels in the body help to oxidize that lens in your eye faster. Think of the lens in your eye like a rusting car when you have diabetes. That oxidation process happens much faster. Diabetics also tend to have damage from the increased blood sugar to their nerves throughout the body, and the nerves of the eye are no different. And so, the nerves of the eye, one of their main functions for the cornea is to give your cornea a signal that it's getting dry, and the nerve needs to stimulate your lacrimal gland to release tears to lubricate your eye. In diabetics, those nerves don't work properly, and so dry eye, severe dry eye that can even lead to corneal ulceration can be very commonly seen in patients with diabetes. So diabetics need to have an eye exam at least once a year to screen for these things. However, if they have a problem, they're going to be seen more frequently, and they're going to have a harder time to heal a problem with their eye from diabetes the same way they do anywhere else on the body. And so, people, diabetes is reversible. Type 2 diabetes is reversible because what we need to do is regulate our sugar intake and regulate our blood sugar. And again, this all goes back to our diets and the way we're eating. And we don't need to depend on pills to just do everything for us. We need to look at our bodies as machines and premium luxury vehicles that we want to last us a long time. And so we need to be putting the proper fuel into them. And if a person has trouble, I refer my patients all the time to my sister is an integrative and functional nutritionist and dietitian. She's one of the smartest people I know. And when I have patients who are having difficulty getting their diabetes under control, I'm referring them to her because sometimes it's just simple lifestyle choices and you can make a big, big difference because diabetes is reversible. And loss of eyesight, that's not something that you want.
Absolutely.
Yeah.
Exactly. Always want to prevent.
Yes, it's preventable.
Absolutely. So, Dr. Skeens, what are some of your greatest, proudest moments that you've treated patients?
Sure. Yeah. Well, it seems like I have. I'm just so blessed. It seems like I have so many patients every day telling me how I've changed their life, how I've restored their vision. I mean, even something as simple as a cataract removal. Patients fear loss of eyesight only second to death. And my whole eye care model, Bellacy, my whole model is based around taking the fear out of eye surgery for patients. So my clinic is not your typical eye doctor clinic. It's not white walls, fluorescent lighting. We have a spa-like environment with warm colors. And from the time the patients enter the office until they leave, our goal is to make them relaxed and comfortable so that they're not afraid of their eye surgery. It's very scary to think about having your eye operated on. And every patient that comes to an eye surgeon, they're all wondering, am I going to lose my vision if I let you operate on my eye? And so we want them to feel very relaxed and confident when they leave that we're going to restore their vision. And, I have patients, because I'm a cornea transplant surgeon, I have patients all the time that their corneas are completely scarred over and they can't see anything except a light or maybe a hand motion in front of their face. And then we give them a new cornea. And I always tell them, and I always, in the operating room, before I put that new cornea on the patient, I stop And I thank the person that donated that cornea, because people forget that it's a donated organ. Okay, you're thinking it's not a liver or a kidney, but yes, somebody still passed away and donated their eye so that you
Right.
could see. And
Yes.
we need to give that the respect it deserves. And I always make sure I discuss that with my patients that are organ recipients. And they're very grateful. Um, but we always take that moment of silence in the operating room when we're getting ready to transplant a cornea. And those corneas can come from all ages. They can come from very young children all the way up until, someone that's more elderly. But I get a lot of satisfaction out of people coming in on a daily basis and telling me that I've changed their life, that, they can see to do their job now, that they hadn't been able to work, they hadn't been able to drive, they hadn't seen their grandchildren, and they're just so excited to have their vision restored. And that's very satisfying.
That is so beautiful. I mean, there's nothing like, having your vision. That if there was a time that you just couldn't see, blindness or whether, your cornea, but having your vision come back, whether someone donated the cornea to you, your vision is the most precious, is,
Yeah.
what you have. So, and I love also what you said about, having that, creating the spa-like environment. I think patients is very soothing, it's very calming. So when you're about to have an eye operation done, whether it be minor or not, but still being in that environment really helps and it soothes you and it calms you down. Whereby, you might be fearful that,
Mhm.
or you may not believe that it's going to be successful, right? Would you agree that being in that kind of environment really helps patients?
Well, it does, and multiple studies have shown that. So,
Mhm.
multiple studies have shown that the color of paint on the walls, the music, the soothing music that you play, the lighting, multiple studies have shown how that helps to ease fear in people. I mean, that's the reason why spas are set up the way that they are. So, there's no reason why that can't be transferred over to our patient care.
Yes.
And
Mhm.
not just in an eye clinic, but in a regular medical clinic. Why should they be cold and sterile? If you think about it, they're so cold and sterile. You
Oh yeah,
already don't want to go in there.
that's right.
Yeah.
I mean, it's white and it's
Yeah.
kind of sterile. You're right. Yeah. So, what's the most difficult procedure that you have performed in surgery?
Uh, my some of my nurses, they joke sometimes that I'm the doctor who performs the total eye. So, people have a total knee or a total hip replacement. That's
Right.
the term used in orthopedics. We don't have that term in eye, but they
Okay.
jokingly say I perform the total eye. So, that's when the patient has had an injury and there's scar tissue throughout the iris, the colored part of the eye, and there's a cataract and there's a cornea scar and everything is just scarred up and you got to take it apart, put it all back together. That's what
Wow. Oh
so
my gosh.
so that's called a total eye. So that's I have those from time to time, and those are definitely the most difficult things to do.
Wow. Wow. How often would you say you have those kind of procedures to do? Like in a day?
Not so in my specialty more often than not, but maybe several times a year. I just had one a couple of weeks ago, actually, that I worked on and was able to restore vision in. So those really severe cases like that, maybe they come up 3 to 4 times a year. So they're not as common, fortunately, but they're there.
Well, Dr. Skeens, this has been such a powerful conversation, learning about the eye from you and what we can expect, it can be preventative. I really want to thank you for sharing with us and with our audience. So where can people get in touch with you and learn more about ophthalmology?
Yeah, so there's a number of ways. You can email me at info@bellac.com. That's B as in boy, ELLA, S as in Sam, EE.com. Also, you can follow me on social media, Instagram, Facebook, YouTube. My channels are Bellac_eye care. The name of my brand is trademarked Bella C. So if you just do a Google search of that, you'll pull up my information and all information on me. You can get in touch with me that way.
Okay, that's wonderful. And we will make sure that, we will drop the show in the show notes. Well, thank you so much, each and every one of you who tunes in to Ask the Experts podcast. You've heard from my amazing guest, Dr. Heather Skeens. She's a renowned ophthalmologist, and what she does is just so truly remarkable. But we want you to take care of your eye health, have regular checkups, as Dr. Skeen has mentioned. Just like we take care of our bodies, you got to have regular eye checkups. Go to your optometrist. If you need glasses, don't put it off, because your health is your wealth. And we want you to live a very life that's of success, but you need to have your vision, and that is the most important. So, Dr. Skeens, we appreciate your time today. Thank you so much. And thank you to each and every one of you who tunes in to Ask the Experts. So we will see you on the next episode. Stay tuned. Bye for now.
Thank you. Bye-bye.